Sorry, 1 second. Sorry, 1 second.
Well, I think we're up on Facebook at least.
Are we?
We are. It's showing live on Facebook.
Okay.
I'll wave.
All right, guys, you guys are live.
Excellent. Thank you all for joining us tonight. My name is Donna Kim Murphy. I'm one of the co-founders of Doctors in Politics. Tonight we have Dr. Pritesh Gandhi and Dr. Christine Mann joining us. I wanted to spend the first few minutes here telling our audience a little bit about our organization. And I will briefly introduce myself, and then we will hear from our candidates and then just jump into the questions that we have for the next 60 minutes. So Doctors in Politics is a political action committee that supports and encourages more doctors to run for Congress, believing that at this moment, doctors are uniquely positioned to champion the best care for patients and be a driving force to heal America's healthcare system. We believe that health policy should go beyond conversations about only health insurance to the broader view that all policy affects health. We support Democratic and independent physician candidates who advance a vision of affordable, quality, patient-centered healthcare. We are profiling 10 candidates to watch in 2020. Looking ahead, we will conduct a national candidate search to identify 50 doctor candidates to run for Congress in 2022. Understanding that running for public office at this level is competitive, we will mobilize, amplify, and support these doctors to step into their urgently needed role as public stewards. The 4 issues that our organization champions are, and this is through our candidates, are quality healthcare for everyone in the United States, gun violence studied as a public health crisis, women's medical decisions free of politics, and climate change is viewed as a serious health concern. So a small group of us came together just a few weeks ago and decided that it was time for doctors to basically have a seat at the proverbial table. A couple of us actually had run for public office before. I'm one of those people. I ran for local office in Pearland, Texas, which is a suburb of Houston. I had been for a while quite active as an advocate, an organizer, an activist. And I'm also a physician scientist. That's my day job. And I felt that, honestly, I mean, the way I've kind of looked at change in systems, right, is a bit like how we look at evolution, which is a process that happens because there are external forces that drive the organism to evolve. And my view had been for some time that really you only affect change as a force that is external to the system. But what I realized over time is that you do, in fact, have to have elements internal to that system that are receptive to that pressure. If that pressure is not perceived internally, then the system or the organism does not evolve. And so I thought it was really important for doctors to actually run for public office and to hold those elected seats. And that's what motivated me to join Doctors for Politics. So I'm going to now pass this over to Pritesh and give him a couple of minutes to introduce himself and to share with us his vision for healthcare.
First, I want to say just I'm thrilled that you all have come together to start this organization. I couldn't agree more with your sentiment on what is needed for change at this time. So thank you for having me. Thank you for having all of us here to have this really important conversation. Just by way of background, my name is Pritesh Gandhi. I'm a dad. I've got 3 young kids. I am a son of immigrants, born right here in Texas, in Houston. And I'm currently the Associate Chief Medical Officer of a federally qualified health center here in East Austin, where I'm Director of Adult Medicine and practice as an adult internist. I'm trained in both internal medicine and pediatrics. We serve about 20,000 uninsured and underinsured Central Texans, and I've spent my entire life in public service. And particularly over these last few months, we have seen firsthand the failures of the Trump administration to deliver life-saving medical equipment, supplies, put together a supply chain that can truly help folks that are on the front lines of this crisis. This is, of course, no surprise to anyone here. For me, my life has been spent fighting for the dignity of people. 15 years ago, after a background in economics, international affairs, I pivoted. I was working for a year in India, in Bombay, working in a landfill predominantly on access to clean water. That year as a Fulbright scholar changed the entire way I look at systems. I think what we all know is that systems are designed to produce the outcomes that they do. And if we cannot get at root causes, if we can't get at why systems are designed how they are, we will not be able to effectively make change. And so this drove me to go back to school, got my public health degree, my medical degree. In 2012, after Sandy Hook, started this national group at that time, Doctors Against Gun Violence, based in the state, and crisscrossed the state, fighting for a public health approach to gun violence. This was right after Sandy Hook. And that movement pushed me back home to Texas, where in 2018, at the height of family separation, I organized one of the largest rallies in the country in Tornillo, that border town right outside El Paso, and we stood for those children. And so for me, look, I sat down with my wife last year. We sat down together and we said, look, we are children of immigrants. We've got 3 young children ourselves. I'm a primary care physician for the uninsured and underserved, and we have a moral obligation to tell the stories of the people we serve and put people and science and dignity above partisanship. That's the kind of campaign we're running. That's what I'm excited to talk with you all about tonight. Very briefly about healthcare. My entire philosophy on healthcare is driven by a quote by Wendell Berry. Rats and roaches live by the competition of supply and demand, but it is the privilege of human beings to live under the laws of justice and mercy. We'll get into that in detail later tonight, but suffice to say that money should never be an object to be able to access care in this country. It is a human right, and I look forward to having that conversation.
Excellent. It's great to have you here, Pritesh.
Thank you.
Christine, please share with us a little bit about yourself.
So thank you guys also for having me and for starting this group. And I love what both of you guys said about systems. I'm a family practitioner in a small private practice in Cedar Park, which is just north of Austin. The district that I am in came close to flipping in the last cycle. And so it's a great opportunity for a pickup in Texas. It's one of the 7 targeted seats in the state of Texas. And so I've been involved politically for quite a while. I started advocating for universal health care around 2009 when we were still having discussions about the ACA. And I've been working with various groups since then. I've been both politically involved and activism involved for several years. I was the leader of a group called Wilco Indivisible, which sprang up right after the 2016 election. I've been down to the border thanks to Donna and connections through groups that I am in online. I also belong to a group called Doctors for Camp Closure, and I have participated in a couple of protests with that group trying to shut down the detention facilities that we are sending immigrants to as they try to seek asylum in the United States. So I really feel strongly, Donna, what you were talking about that systems pressure. Being an activist for the last several years, I got to the point where I was like, this isn't working. Nobody is listening, and I've got to get on the inside to do this. And so I ran in 2018. That was my first run for Congress. I've been working to help get other people elected in my district for almost a decade. Then I stepped up in 2018 to do it. I made it into the Democratic runoff in my district and did not win that runoff, and immediately jumped back in, starting to do political work in the district to keep pushing forward to prepare for this run in 2020. And this time I am determined to make it all the way. And I'm super excited to be a part of politics. I absolutely love what I do. I say that every time I have one of these events. My gosh, I just want to keep doing this forever. So I'm thrilled to be here. In terms of healthcare, my bottom line, and this is what I've been talking about since 2009, is universal healthcare coverage without regard to your pre-existing conditions, your job situation, where you live in the country. You should be able to start your own business and not have to worry about healthcare coverage. My preference is with a single payer system, but I will have a discussion with anyone, anywhere about anything, any system that gets us to 100% coverage guaranteed for everybody in this country.
Excellent. We are so lucky to have both of you with us here tonight. And I think it was so fitting that we started actually with two candidates from a state that is that is considered kind of a bellwether for the rest of the country. So let's just jump into our questions here. We're going to have about 10 minutes of really fast moving questions. Some of them are kind of lighthearted and others are a little bit more serious. But the rules of this this section are that you have to answer the question in 5 seconds or less. And I'm going to try to do that. So just a few words. And you'll hopefully have some time to elaborate on some of your positions more substantially when we move to kind of longer form questions and also questions that we take from the audience tonight. All right, so let's start with Pritesh. What has been your go-to snack during your campaign?
Oh gosh, almonds?
Oh man.
And Christine, how about you?
Chocolate chip cookies.
Fantastic. Christine, what quote motivates you?
Oh man, there's so many. The one that I have on my page is, it's actually from the Transformers, and I'm not going to be able to remember it right now. I know everyone makes this funny face when I talk about it, and I can't remember it. I will try and remember it before we leave tonight. All
right, Pritesh, what about you?
I said one at the beginning about a Wendell Berry quote, but the second one that drives me is Dr. King talked about the fierce urgency of now, and that is what drives this campaign, this understanding of how people live their lives.
Absolutely, yep. The moment that we're in, especially with the post-COVID era also. What is your greatest accomplishment outside of medicine, Pritesh?
Personal accomplishment, aside from having 3 wonderful little kids, it is to overcome a severe stutter as a child. Like Vice President Biden, you can't tell now because public speaking is my currency. I had a severe stutter, and my father made me join the speech and debate squad when I was in 9th grade. I went to speech therapy 3 times a week since age 5 to overcome it. I speak at the local camp here for stutterers. It is by far my singular accomplishment and something that I deal with to this day.
And Christine, how about you?
I am an extreme introvert. So being out of the campaign trail and communicating with people in a format that has been way outside of my comfort zone and getting comfortable with it has been a huge thing for me, a huge accomplishment.
Wow. Who was your defining icon of your youth, Christine?
My mom. She worked multiple jobs and raised kids after being a divorced single mother, and her work ethic drives me. She's where I get my work ethic.
And Pradesh?
My grandfather, he was an immigrant, came to this country for a better life for his family, and treated every human being with dignity. Every human being, every interaction till the day he died. And that is how I've modeled my life.
Pritesh, who has, or what has been your greatest personal challenge during the pandemic?
I think balancing work and my kids, safety for my children. You know, my daughter came in the room today, no joke. She walked into the room and she said, Dad, she said 500,000 people have died from this virus. Now she's 6, she got the numbers wrong. And right after that, my second child, my 5-year-old said, Dad, what does Memorial Day mean? Back to back. These are my kids. And balancing that, safety of my kids, having them understand what's happening, it's been hard. It's been a challenge.
Christine, how about you? What has been your greatest challenge during the pandemic?
Tamping down rumors that pop up. It feels like I'm playing whack-a-mole all the time with the conspiracy theories that are coming up constantly. And as a candidate, I get asked about those conspiracy theories just nonstop. People send me information and, hey, is this for real? And I'm like, oh my gosh. So it's been really hard.
Yeah, I mean, they say that the COVID infodemic is as malignant, right, as the pandemic.
Yes.
Christine, what is the most unusual fact about your congressional district?
That it is one of the most gerrymandered districts, but it is so compact. It only takes me 45 minutes to get to each part of the district. So it's super gerrymandered because they carved out a bunch of Democratic precincts, but it's easy for me to see and interact with everybody in the district.
Wow.
When there's not a pandemic.
Yeah, right. How about your district?
Look, this is also a gerrymandered district. The Republican Party went haywire in the early 2000s here in Central Texas. And so this is what we see is this. It takes 3 hours to go from corner to corner. But I think the biggest fact that I like about this district is that, or that I always note for people, is that the incumbent, Representative McCall, in the middle of a drought in Austin, his family was responsible for more water use than any other private citizen here in Austin. This was a couple of years ago. And I think it sort of tells you what you need to know about the district and the incumbent. So,
wow. What is the most, this is for Pritesh, what is the most, what is one thing that you wish that you would have known before you ran for office?
Well, I'll be honest, about a few months before running for Congress, I was going through my Facebook and just deleting folks that I hadn't talked to in years. I went through my phone list and just cleaned up all my contacts. And then I ran for Congress and I realized, well, shoot, I got to talk to a whole bunch of people. And I wish I would have thought that through the months prior to running for Congress.
How funny. Christine, how about you?
Yeah, so we're writing a book about this because there are so many things that you just don't know about what happens when you're running for Congress. But I think the number one thing would be how challenging it is, even within your own party, to get people to hear you and listen to you and understand what you're all about. Mm. And I found my quote whenever you're ready.
Shoot.
What is the quote? Yes.
This is Optimus Prime. Fate rarely calls upon us at a moment of our choosing.
Wow.
Yeah, and that just meant a lot to me when I was first running because of how desperate the situation was in the country. And so, yeah.
That's great.
Christine, this is a good question to give to you first, I think. Is there any difference to you between an activist and an advocate?
Yes, you can advocate and not put yourself at risk. For me, activism means putting yourself and your body and your life into situations where you might be in harm's way. It takes advocacy one step further. I'm not saying that advocacy is lesser, it's just different.
Okay, and Pritesh, how do you feel about that? Is there any difference to you between the two?
There is probably an academic difference that I am not qualified to talk through. What I would say is that you really need both advocacy and activism to be able to make political change, because it's with advocacy and activism that you build political power. And ultimately, we can't do anything without political power. So that to me is a very clear balance between both of those two avenues.
Excellent. I have so many more like shorter form questions here, but we're running out of time. So let me ask you one that I think it kind of speaks to doctors in politics. Pritesh, name 3 ways in which race comes to bear on health.
Let's look at the news today, right? A Black man couldn't breathe. And if folks don't think that generational stress matters, we have all the examples we need. And so racism affects stress and cortisol levels, way 1. Way 2, historic inequities in, for example, in East Austin, where folks don't have access to education for a variety of reasons, right? Education matters. A third area is look at the disparities that we're seeing now with this pandemic. 30% of Austin is the Hispanic population, 60% of those hospitalized because of access to care. Again, a lot of it driven by inequities. And so we could speak all night. We could speak all night on implications of disparities because of race and ethnicity.
Right, and this issue is actually not among our 4 issues in Doctors in Politics, but the reason I bring it up is that our vision is a very intersectional vision, and I think that race intersects with basically everything.
Good question.
So Christine, how about for you? What are 3 ways in which race affects health in your judgment?
So race and racism is systemic. And when we go back to it, I can name 3 separate things, but it all ties back together that virtually every system in the United States has a racism core, a systemic racism core. And that long-term stress on a person, as Pritesh so rightly pointed out, raises cortisol levels. There's a statistic that every 7 minutes in America, a Black American dies prematurely because of a lifetime of stress on their bodies. We can measure differences in cortisol levels at about age 20 in people, and at age 6, we can already detect racial bias in children. So it's that lifelong exposure to systemic racism, whether it's housing where you can't afford a house that is free from pests and pesticides and chemicals, to banking systems where you can't get a loan, to employment where you can't get a job interview. All of those things accumulate and feed into the poor health status of people who are of color. And then you layer on top of it something like this pandemic, where there's an acute need for care. We don't have universal health care coverage in the United States. So people who are Black and brown have less access to care. And on top of that, you have a system where Black and brown people are often our frontline workers, people who have to go back to work because they don't have the financial resources to distance and stay at home. And it's just a perfect storm for putting these people at higher risk.
So I'm going to move us into the longer form questions. I did a very bad job of moderating and keeping you guys to 5-second answers because your answers were so interesting. So I wanted to hear them. Let's move now to the long form questions where you actually will get a full minute to answer the question. Sure. I will start with you, Pradesh. What is one domain of policymaking that people don't ordinarily see as related to health that you see through a health lens?
Yeah, I mean, I think we just touched on this, but it's important. We cannot fall into the trap of talking about health insurance as just health, right? I mean, so the big domain that I would look at are these social determinants of health, which I know for many of the viewers as part of this group, this is what we live every day, right? This is my world, social determinants of health, poverty, how all these things intersect. But look at some basics, right? In Austin, for example, and in Houston, if you're a Black or brown child, you have a 2 to 3 times higher rate of living in a food insecure households. We see these disparities in poverty as well. We realize that there are eligibility gaps in WIC, eligibility gaps in SNAP, eligibility gaps. There are gaps in actually getting your earned income tax credit done, right? And all of these things are tools that are and should be leveraged to deal with so many of these issues. But we never talk about these issues at the policy level in an intersectional way. We talk about it in their own silos. This is why it matters to have public health professionals, to have physicians, to have others in these leadership roles, because we live at that intersection in our clinics, right? Like in my clinic, we have partnered with a local group to do earned income tax credit and taxes for our patients, because we know that it reduces poverty, right? We partner with groups to do food stamp signups, SNAP signups in our clinic waiting rooms. We do social determinants of health screening because we understand the value of those things. So that's the domain, SDOH.
Excellent. And Christine, how about you?
I had a discussion about this on Twitter recently, where a prominent physician who I follow said that he really didn't like talking about politics in the couple of minutes that he had with a patient in an exam room. And I replied to him, I said, everything, it revolves around politics. Every single thing you do, that person who's in your office for diabetic eye exam, something in politics can affect their ability to get to your office, the fact that they have diabetes in the first place. Everything is structured around that. So the short answer is everything has to do with politics, but I'm going to give you an example of one thing that people don't really think about and how that relates to health. Let's talk about transportation. If you live in a place that does not have public transportation and you can't afford a car, you might not be able to get to the grocery store where you have fruits and vegetables available. You're left shopping at a convenience store where your food options are snacks and chips and sodas. If you don't have the ability to get to a job, to be able to pay for the things that you need, your medicines and your doctor's visits and so forth. So transportation.
Yeah, but I mean, and just to add in there to what Dr. Mann was saying, being political does not mean that you have to be partisan. I think for so many of us that work in the nonprofit sector, we shy away because you're in a nonprofit, you can't be partisan, but political, that is, we've got to advocate for the people we serve. And so I think that's been a huge lesson learned for so many that work in the sector.
Christine, let's start with you here. How can we leverage this moment, namely the coronavirus crisis, to reimagine a more equitable health system?
We who work in medicine, and particularly people who work with underserved populations like what Pritesh does, we already know the inequities that are in the healthcare system, but this pandemic has shown a spotlight on how bad it is, how people have access to care in some areas, they don't have access to care in other areas, how social determinants of health that we've been talking about affect whether or not a person comes down with COVID-19 because they are a frontline worker and they can't avoid their job. We already know that Black and Brown Americans don't have as much savings because they haven't been paid the same amount of wages that white Americans have. So they can't afford to be off work and take care of their kids at home and not go to their job. So this pandemic has shined a light on not just healthcare disparities, but disparities across the board in all the systems that we have in the United States and how they feed into our health status. So I think that we need to, as doctors, leverage that to affect change.
And Pritesh, how about you?
I think Dr. Mann points out very, and rightfully so, that our safety net has been systemically dismantled by those in leadership over the last few years. And when we opened our eyes in the middle of a pandemic, we realized, well, crap, everyone affected, there's nowhere to go. People are hungry. Well, damn straight people are hungry. 1 in 7 Texans were food insecure before the pandemic. People are moving into poverty. No joke, 20% of kids lived in poverty in the state of Texas before this pandemic. People are having unequal access to care. No surprise, for Black women, twice as high of a maternal mortality rate than white women in our state. People don't have access to care, broadly speaking. Of course not. We have the highest percentage of uninsured in the United States here in Texas. This is no surprise. We've destroyed our safety net in the name of economic independence and whatever else the Republican Party would have you believe. And now we're surprised when we wake up in the middle of a pandemic that if folks need help and that they're 1 or 2 paychecks away. That's the whole reason why many of us 2 years ago, me included, were testifying at the state capitol on paid sick leave, because we know that if paid sick leave was a national policy in 2010, 7 million cases and 1,500 deaths would have been averted. And the United States is always last in line to do what's right for people. So anyhow, don't get me started on this pandemic.
Right.
It is just an absolute failure of this style of politics, and we're seeing it now.
Pritesh, how do you think we can occupy the political arena as physicians while still maintaining the public's trust?
Yeah, I think that we bring science-driven leadership wherever we go. We talk facts, we talk figures, right? Last week, I went on CNN and we talked about hydroxychloroquine and that Lancet study that came out that showed with 15,000 patients taking that drug, 60,000 patients who weren't. It was an observational study. So of course it wasn't randomized controlled trial, but it was pretty large as like 4 of the prior trials put together, and demonstrated that frankly, there was not benefit from the drug. In fact, there was some harm associated with it, right? We have to be able to tell that story. In fact, we have an obligation to do that, and we can do that without having to be biased, right? We can be objective. We can amplify the stories of the patients that we see, right? All of us here, we have a clear line of sight into the vulnerabilities and challenges and obstacles and resiliency of people we serve because we see it in our exam rooms. We have therefore an obligation to tell those stories at the highest levels of government.
Christine, what about you? What do you think?
I'm going to tell you a little story. There was some information that came out, I don't know, a couple of years ago about people in Kentucky who hated Obamacare, but loved the Kentucky version of the Affordable Care Act. Which was exactly the same thing, that they just were so averse to that term Obamacare and to think that President Obama gave health care. And I bring that story up because my version of this is meeting people where they're at. What I do in my office, and I've done forever, is I talk about how they can access care. And my go-to example is colonoscopies. I've had so many people over the years say, oh, I really need to get a colonoscopy, but I don't think my insurance is going to cover it. And I'll say, they have to. That was one of the requirements of the Affordable Care Act, is that your insurance must cover your screening colonoscopy at 100% with no out-of-pocket expense. So I think meeting people where they're at, talking about the things that are directly of concern to them, is how we retain that credibility, yet bring that information to them about how we can be more of an advocate for them in Congress.
That's great. I hope, if nothing else, like physicians who are tuning into this are kind of taking mental notes about how we infuse our discussions with our patients.
I talk about politics in my office all the time, and I have for years. I can give a tutorial if anyone needs it.
Excellent. Christine, I love this question. What do you hope will emerge from the Bernie-Biden collaboration?
I was so excited to see the committees that they put together to influence the platform for the Democratic Party. There was some really interesting picks that would never have come about without Bernie Sanders and his people being around. I was always a Hillary Clinton fan. I respect Bernie Sanders. And I like that he brings something to the conversation that needs to be said. So that collaboration, I think, if we can bring together people who really want to move forward more quickly and join with people who are a little bit more cautious, that's a winning combination for taking some steps forward from here.
Excellent. And what do you think, Pritesh, about the collaboration between the two?
Sure. I was a big Hillary Clinton fan. I'm a big supporter of Joe Biden right now, obviously. But 6 years ago, I had heard Senator Sanders speak and was inspired by one of his talks on inequity. And so inspired that I gave a grand rounds at Tulane in 2000 and in 2015 on how inequity affects health outcomes, and did a comparison of inequity in our country by income, and frankly, even in our state. The United States, Texas is one of the worst in terms of income inequity. And then when you compare that to child well-being, we're essentially at the bottom. And then when you look at the Gini coefficient, which is this marker of inequity, and you look at the United States compared to the other top 50 developed countries in the world, we're at the bottom of inequity there. We're not surprisingly at the bottom of health outcomes there. I was inspired by that work of Senator Sanders. I believe that he and his coalition can inspire so many more to talk about these issues in a way that isn't just lip service, but in a way that leads to true and meaningful policy change.
Love that. You're giving me chill bumps.
We are stronger together in this fight.
Yes.
We are stronger together. And that's
Absolutely.
what this Bernie Biden coalition is, a winning coalition.
Yes.
Yes. And I think that's true, of course, like outside of our profession as well. But I will, use the opportunity to say that part of what we want to do in Doctors in Politics is actually build community among physicians who have this kind of worldview, to bring us together and to build, a political coalition, basically, of physicians, who share these ideas. Pradesh, why do you think that doctors have historically been so resistant to engaging in politics, and how do you see that changing?
Well, let's take a step back and just note that doctors have advocated for their patients. I think that it may not be always clear and in the front of people's minds, but I mean, let's think back to the start of the health center movement. Dr. Jack Geiger started this health center in the middle of the Delta. And I think for those of us, we've probably heard this story a million times, but in the face of overwhelming malnutrition, he started writing prescriptions for food in the middle of the Delta, decades ago. That was advocacy. Physicians, healthcare professionals, others have been on the front lines doing this work. And I think what we're seeing now, though, is that we haven't accrued enough political power to actually change some of these structures. These are what these conversations are about, right? A couple of years ago, I was at a training session for organizers, and this gentleman came in from El Paso, West Texas. He's a trained organizer. He was coming in to train us. And on a Sunday afternoon in a church, he slammed his fist on the table and he asked, "Why do we organize?" And he slammed his fist again. He slammed his fist again. He said, "We organize for political power." I think that for so many of us, we have seen the deleterious effects of government policy that has damaged our patients. And so this is what we do now. We have got to gain political power to improve the well-being of our patients and their communities.
Christine, what do you think? Why have we been so resistant in the past, and how can we change that?
It's always said in America that the two things you can't talk about are politics and religion. And I think doctors have found it uncomfortable to have conversations about politics and about their political view. We present ourselves as just unbiased sources of information and something that all patients can rely on, and we don't want to make it uncomfortable for patients to be able to be open and honest with us in the office. And that's an advantage that those of us who are in primary care have, because I've built relationships with people over 20 years. I've got Republicans who come to me and say, "I will definitely vote for you because I know you and I trust you and you've been my doctor forever." I think more doctors are getting involved more recently. I think it has to do with the younger generations of doctors who are coming out. They are much more socially aware. I think that medical schools are teaching more about these social determinants of health, and doctors are realizing, well, me as my own individual doctor in this office, I can't change much with that. But if I become politically involved and get involved in those systems, maybe I can.
Excellent. Why do you think, Christine, that doctors are uniquely positioned to lead in Congress?
The training that we have positions us to do this work. We are used to being inundated with vast amount of information, synthesize it quickly, and come up with solutions for this vast amount of information. On top of that, we are used to being able to judge the validity of information that is put in front of us. It is my job every day to look at all sorts of data and evidence and to make a decision about what makes sense and what doesn't, and synthesize that and put it into terms that my patient can understand. The other piece of it is that I have to talk people into doing things that they don't want to do all day, every day. I have to convince people to take blood pressure medicine and get their colonoscopies. That's another skill that we have as doctors that we can use when we are in those rooms negotiating with other people.
Yeah, and I think to add on there, we know how to work in a team, right? When I'm taking care of a patient in the clinic, let's say a patient who has diabetes, the A1C, a marker of diabetes control, is not where it needs to be. It's not me in the room. It is me. It is a nutritionist. It's a social worker. It is the nurse. It is the health educator. It is the community health worker. We are leveraging a team to do what is right and just for this patient and their family. I think people have forgotten at times in leadership how to work in teams, don't understand how to reach out of your own silo and work with other folks in different fields entirely. That is a clear value that physicians in particular bring to leadership, and something that's sorely needed in Washington.
Excellent. Pritesh, how will you explain to your constituents that federal dollars should address our chronically medically underserved border communities, given that your district actually is not at the border?
Yeah, I mean, I think that the health and well-being of our neighbors matters. It matters because we believe in dignity, we believe in equity, we believe that the children in those border communities will end up leading our businesses and our stores and our factories and our educational institutions, and that we are not to wax here. We are as strong, really, as our weakest, most vulnerable communities. We have forgotten this sense of fellowship, I think. When you look at data in this decade compared to past decades, we are at a historic high in terms of loneliness that we feel as communities. Our neighborhood ties have seemed to have frayed, and we need to rebuild. We need to rebuild that. And I think that starts from understanding our shared human experience and having a dignity-driven conversation. That's where I'd start.
I know that you've been to the border with your visit to Tornillo. I'm sure you've been in other instances as well. Christine, I know that you've been because I organized for you to go.
Yes.
So for you, how would you talk to your own constituents about that? That it's a topic that doesn't seem to be necessarily relevant to them, right?
Yeah, well, everything Pritesh said resonates with a lot of people. I'm in a district that is largely Republican. It has been a Republican stronghold for a while. So in addition to talking about the moral imperative to take care of people who are on our soil, I also talk about the financial impacts. Sometimes you have to reach people with their concerns. And a lot of Republicans are worried that their money is going to be wasted and they are not going to get anything from it. That's a huge issue among the Republican side of the constituency. And so I often talk about the fact that we already take care of these people. We already pay money for them to get care. We just do it in the most expensive way that we possibly can, because they end up using resources when they are in dire straits, going to a hospital or an emergency room instead of being cared for along the way. And so I think you can make both of those arguments, the moral piece of it, as well as how it directly affects our systems in the United States and how we're already paying to house these people and to care for these people. We're just doing it in the most expensive way that we possibly can.
Yeah, it's really interesting, this the way you convince people who, as you say, don't necessarily see the moral argument, or they don't see these people as deserving of the moral argument.
Right.
And so you do, I agree with you that you have to meet them where you are, but like I have, I just actually got into a conversation with a friend of mine about this, who is undocumented, and he, it's really actually offensive, to him that people would talk about immigrants in terms of their economic utility, right? And
Right.
And I agree with that. I think it's important always to kind of couch this as like, this is maybe the argument that appeals to you, but understand what is problematic about that
Yes.
argument. That's, I think, the only way to change them, right? Like, you want to reach them, but then you want to change the way they're looking at this issue.
It's a tightrope to walk.
Yeah, absolutely. Absolutely.
And you have to kind of feel people out as you're having the conversation,
Right. Right. So this is a question that I think is really relevant for this election year, this historic election year, and that is that in the state of Texas, we are continually actually trying to suppress the vote, and this moment is no different. We're trying to use COVID as a reason to restrict voting further. There has been an attempt to expand vote by mail for those under the age of 65 because of COVID. What are each of you doing to further that fight? Pritesh, we can start with you.
Great. I spoke about this today with the Houston Chronicle. I tweeted about it later today. The state came out with guidance. Get this: the state came out with guidance on how to vote safely at your polling location. It's an 8-page PDF document that outlines the safety precautions that you got to bring with you a bottle of sanitizer. You've got to do this. You got to wipe down this. Maybe you should consider this. I don't know what planet folks think that voters are on, and what resources they have. The reality is that much in this guidance further disenfranchises the very communities that should vote, that are affected by policies at the state level and federal level. And so, you got to call it out. You got to call it out. I've called it out publicly. We are in the middle of spreading a statewide, what's the word I'm looking for? Not a poll, petition to be able to sign by physicians and public health professionals. Dr. Mann, we should talk about this later. We got to get that out. Working on an op-ed. There are many things that we can do. This is, nuts and bolts grassroots advocacy and organizing, and that's the work that we're doing right now. But you got to just call out stupidity when you see it, and this is stupid. It's a public health risk, and we ought to talk about it in plain language, because there are alternatives like vote by mail.
Did we lose you, Donna?
No, I was muted.
Oh, okay.
Sorry. I get fired up about this stuff. It's irritating.
How about you, Christine?
Yeah, so I've been a voter registrar for more than a decade. Voting and voting rights is something that's been in my wheelhouse for quite a while. So it's really very alarming to me, all the things that are being done to try and limit the vote going forward. So we're trying to take a couple of different approaches. I started a group of voter registrars in Williamson County, and so we've been communicating online with what we can do to at least get people registered to vote. And luckily, there are some resources for that. The Democratic Party in Texas will send you an already filled out voter registration card that all you have to do is sign and mail in. It's already postage paid. So if anyone is in Texas and needs that information, Texas Democratic Party is doing that. Going beyond that to vote by mail, as a campaign, we're watching this back and forth very closely. We have one ruling that says, yes, you can. One ruling that says, no, you can't. The next day, yes, you can. The next ruling, no, you can't. So messaging is really, really hard right now. And I saw Pritesh's tweet earlier and haven't had a chance to jump in on that. And that's correct. I mean, that a PDF that is that many pages tells you right there everything you need to know, that it's just not safe for people to be at polling places right now. So we're working through social media outlets to try and get people updated information. Every time there's a change in the ruling, we put that information out as quickly as we can.
Excellent. Yeah, and I will have to connect with both of you offline. The NAACP actually has been working on this, and this fight has escalated right now to the Fifth Circuit Court of Appeals, and they're looking for physicians to submit statements for their amicus. So
Sign me up.
yeah.
Sign us up.
Yeah. Okay. So I'm going to go to some of the questions that we have from our audience at this point. What makes you uniquely qualified over your competition in your district to serve in U.S. Congress? Pritesh, we'll start with you.
Yeah, I want to just at the very beginning say that I'm running against a good man, Mike Siegel. He ran in 2018. He ran a good campaign. I don't have anything negative to say about who he is. What I would say is this, is that we have got to be able to build the coalitions that we need to win. And I think what our campaign has demonstrated is that because I have a lifetime of advocacy, we're able to call on people locally, statewide, and nationally who will support us in this campaign. In half the amount of time as my opponent has, we've built a campaign with equivalent number of volunteers, and we have significant national support. Planned Parenthood has endorsed this campaign, the Giffords campaign against gun violence, the largest organization in the country dedicated to electing scientists, 314 Action, multiple members of Congress, the largest newspaper in Austin. The reason why folks are getting behind this campaign is that we're not running a campaign of ideology. We're running a campaign that's rooted in pragmatism and things that we can do today to bring people and our communities forward tomorrow. That's a key distinction. We have to win to be able to make change. And Mike's politics, he made it abundantly clear after the primary when asked what he would do to reach out to folks in rural parts. You know, he talks about how we need to bring out our base, but you can't win a general that way. You've got to be ready to have evidence-driven conversations with people, Republican and Democrat. You have to earn their trust. You have to be authentic. And what I think people see from our campaign is a campaign driven by this absolute fierce urgency of now. This campaign is driven by the stories of my patients. We won't be outworked. We can raise the resources to defeat McCall. We can build the coalitions we already have. And McCall has never, ever had a competitor that is as well resourced and motivated with the volunteers that we do until this year.
Great. Christine, how about you? Your opponent?
So I have invested in this district for a decade. My opponent is new to politics, hasn't ever run a campaign, and has not put together a team of people to give her the support that is going to be necessary in a general campaign. She has no advisors, no consultants. And I know those are kind of scary buzzwords. People don't like the idea that they're consultants on a campaign, but that's the kind of thing that's necessary to win a congressional seat. You might be able to do it yourself in a race that's lower down on the scale, but not in a congressional race. I also have a concern that she wrote a healthcare policy that suggested that specialists should work as primary care doctors to fill in the gaps in the need for primary care. And when someone has a lack of understanding about the healthcare system such that they don't understand that primary care requires a residency training, you can't just pick up an ophthalmologist and set them down in a primary care office. They are not trained to do that. And if you have that lack of understanding about how the healthcare system runs, I fail to understand how you're going to be able to advocate for a healthcare system that's going to work in this country. So that's a concern for me. The other piece of it is that we have a vast network that we have built up through 2 campaigns that we've run now. And it requires meeting people over that huge amount of time to be able to win. She does not hold accessible town hall meetings. She isn't responsive to people in the district. And that's a formula for loss in a general election. And I'm very concerned about giving up a seat that is a winnable seat.
Right now, there are unmatched doctors who are looking for work. Do you have a strategy to incorporate them into practice?
Yeah, you know, I read a little bit about this recently, and it kind of fell off of my radar because I'm so involved in the, political pieces of campaigning. But one of our biggest issues, and one of the reasons we do have a lack of physicians in primary care, is because of residency slots. We don't have enough residency slots to accommodate the number of doctors that we need to train specifically in primary care. So we need to, at a legislative level, create more residency slots. We need to work with the AMA and the hospital associations that run the residencies to make sure that we are opening up enough slots to have all of these doctors who want to serve have a place to go to complete their training. So that is a piece that is completely necessary as we go into this idea that we're going to cover every American. We've got to also create the workforce to be able to cover every American.
Absolutely. Pritesh, do you have any other additional thoughts?
No, I totally agree. I think that's right. We have a historic physician shortage. We need more residency slots. Let's train folks. Let's get them out in at-risk and vulnerable communities across the country.
Excellent. And Pritesh, what do you think your physician's perspective adds to your candidacy?
This whole evening has been about this very thing, right? It is a privilege to be in exam rooms with people, and hearing that struggle in that intimate level. That never escapes you, and it fuels a fire that cannot and will not be extinguished. And so I think that there is that urgency that comes with the physician perspective. And as we've talked about during the evening, it's this science-driven approach where you can look objectively at data and make objective decisions, right? I mean, there's studies that show that a community-driven program for families that cross the border, instead of being held in jail cells, is equally as effective, frankly, more effective. I think it was like a 97% rate for coming back to their hearing, right? Mm-hmm. That's what the studies show. Now we've got to be able to assess that and then make policy accordingly. And I think that's the benefit of having science-driven training.
Christine, how about you? Do you have any additional thoughts there?
He 100% stole my answer. In my first run for Congress, I told a story about a little girl in my practice. She was 4 years old when she was diagnosed with cancer, and she had a very rare form of cancer. Her family had to do a GoFundMe to be able to pay some of their bills. She was edging up on the lifetime maximum of expenditures long before she was 18. And I carry those kinds of stories with me all the time. They inform my drive to make sure that we have a healthcare system that does not leave people behind, that nobody ever has to think about doing a GoFundMe ever again in the United States. That just drives me crazy that is what we think is normal. And we all applaud when someone does a bake sale and raises money for someone's gallbladder to come out. No, it shouldn't be that way. We should be horrified that has to happen. And the other part that Pritesh was talking about is that data-driven decision-making. I don't have to be emotional about decisions when I've got two pieces of information that say this is more expensive and leaves more people out, and this is less expensive and it gets more people in. And what's interesting is that on virtually every single policy you can name, the things that we have talked about in Doctors for Politics is the less expensive, more inclusive, more beneficial policy. And it kills me that we can't get policy written based on those things. And that's a huge advantage as a physician that you bring into a legislative body, is being able to look at that data and make that legislative decision with clear eyes.
I'm gonna wrap us up with one final question here. Texas leads the nation in rural hospital closures pre-COVID. Now with COVID, many rural hospitals are cash strapped. What can be done to mitigate this problem specifically? Christine.
We did not take Medicaid expansion in this state. That was a horrific mistake that our legislature, the Texas state legislature, continues to perpetuate with every session that we go into. I worked with Representative John Busey at the state house this past session, where he was the first person to ever get a vote onto the floor for Medicaid expansion in the state of Texas. It went down on a straight party line vote. I work with his office on a community advisory board where we are going to start lobbying people who almost lost their seats, Republicans who almost lost their seats in the last cycle, to tell them how important Medicaid expansion is, because they represent districts where there were hospital closures. And Medicaid expansion is the #1 best thing that they can do to take money back to their districts and save their hospitals. So Medicaid expansion, Medicaid expansion, Medicaid expansion in Texas. And then ultimately we have to do at a federal level a fix for the entire healthcare system across the country.
Pritesh.
Dr. Mann stole my answer to this one. I stole her prior answer. I don't know how many, I mean, let me say Medicaid expansion 3 more times. Medicaid expansion, Medicaid expansion, Medicaid expansion, right? This is absolutely silly. This is an example of partisans in leadership because of some wayward ideology making decisions that actually directly harm Texas families. And so Medicaid expansion is one of it, but then we also have to recognize that there is something wrong in our health system where, for example, today we got news that Baylor Scott and White is laying off, I may have misread this, but I don't think I did, 1,800 employees, laying off 1,800 employees, furloughing many others. You look at their recent filings, right? Their revenue is out of this roof. You have significant payments to folks in leadership in the millions. We have got to restructure how we deliver health in our country so that patients and their outcomes is at the center, period. If we do that, we will put policies in place that keep rural hospitals afloat, because it won't be about stock options. It won't be about the equity or the value. It'll be about patients. And we've got to always go back for it. I don't know any better advocate for patients than folks that work in healthcare.
Mm-hmm.
Absolutely. Well, that is a wonderful way to close. Thank you both for joining us tonight. It was great to get to know you a bit more. I'm not sure if you've ever had an opportunity to talk to other physicians in this way, but I think it's unique, the platform that we provide, and hopefully it allows us to kind of build a community of people and to even, build a pipeline eventually of people who will go into public service among our peers in medicine. So thank you again, and we hope to see you in Congress.
Hey, look, I'm thrilled to be here, and I think Dr. Mann, you would probably agree with this sentiment that we can't do it without the support of all the doctors that are listening today. It costs millions of dollars to run congressional races, and Dr. Mann and I both are primary care physicians. We can't do it alone. We need your help. If you're inspired by what you saw with us tonight, please find our websites and help us get there.
Absolutely. And we, in Doctors in Politics, we have one idea that hopefully will persuade some of our colleagues to contribute in maybe a novel way. And that is, if you feel like you can't otherwise commit budgeted salary towards supporting a candidate, what you could do is to work an extra shift. So if you can donate a shift, a moonlighting shift, or the equivalent of a moonlighting shift, that could go a really long way for our candidates. And we'd love to see our colleagues doing that. And
yep. And if you want to take a weekend moonlighting shift in Montana in a rural town, which we all know will probably do okay, then you can feel free to do that as well. And I'm sure Dr. Mann and I will be thrilled to have your support.
Excellent. Well, thank you guys again.
All right.
Thank you.
Thanks
Good
for
evening.
having us. Thanks.
Bye.